UK ranks bottom for cancer survival rates for 5 types of tumour including lung and pancreatic. Major study findsResearchers compared death rates from 7 different forms of the disease. Australia topped the charts for 5 forms, Canada and Norway the other 2, but the UK placed near the bottom of the league table for all of the cancers. The analysis found the UK ranked last for 5 cancers, including pancreatic, by Stephen Matthews, health editor for Mail Online, published 22/18 British Summer Time, the 11th of September 2019, updated 3:07 British Summer Time, the 12th of September 2019. Cancer survival rates in the UK still lag behind other high-income nations despite progress in the last 20 years, a major study has found. Researchers compared death rates from 7 different forms of the disease, including lung, ovary, and colon, between a handful of nations. Australia topped the charts for 5 of the different cancers. Canada and Norway claimed the best 5-year survival rates for the other 2. However, the UK placed near the bottom of the league table for all of the diseases, including dead last for stomach, colon, rectum, pancreas and lung. This is despite survival rates having doubled across the UK for esophagus, lung and pancreas cancer between 1995 and 2014. Australia topped the charts for 5 of the different cancers. Canada and Norway claimed the best 5-year survival rates for the other 2. However, the UK placed near the bottom of the league table for all of the diseases, including dead last for 5 of them. The analysis revealed researchers compared death rates from 7 different forms of the disease, including lung, ovary, and colon, between a handful of nations. Figures showed 7.9% of patients in the UK would survive 5 years if they were diagnosed with pancreatic cancer, up from 3.3% 2 decades ago. The odds of surviving lung cancer jumped from 7.2% to 14.7% in the same time frame, and the rate for esophagus cancer rose from 8.6% to 16.2%. Survival rates also improved, but not as significantly, for the other 4 forms of the disease: stomach, colon, rectum and ovary. The study, based on data from nearly 4 million cancer cases spanning the entire 20 years, was published in the medical journal Lancet Oncology. As well as the UK, Australia, Canada and Norway, survival rate data was taken from records of patients from Denmark, New Zealand and Ireland. How did each nation rank compared to each other for 5-year cancer survival rates? Esophagus, stomach, colon, rectum, pancreas, lung, ovary. Australia 23.5, Australia 32.8, Australia 70.8, Australia 70.8, Australia 14.6, Canada 21.7, Norway 46.2, Ireland 21.9, Canada 29.8, Canada 66.8, Denmark 69.1, Canada 11.1, Australia 21.4, Australia 43.2, Norway 19.4, Ireland 28.4, Denmark 65.7, Norway 68.8, Norway 9.9, Norway 20.4, Denmark 42.1, New Zealand 16.9, Norway 26.9, Norway 65.4, Canada 67.0, Denmark 9.6, Ireland 19.8, Canada 40.3, Canada 16.3, New Zealand 24.5, New Zealand 62.1, New Zealand 65.4, Ireland 9.6, Denmark 18.9, UK 37.1, UK 16.2, Denmark 22.6, Ireland 61.8, Ireland 62.4, New Zealand 8.2, New Zealand 15.5, New Zealand 36.3, Denmark 14.7, UK 20.8, UK 58.9, UK 62.1, UK 7.9, UK 14.7, Ireland 36. The Cancer Research UK-funded study found Ireland and Denmark had the worst 5-year survival rates for ovarian and esophageal cancer, respectively. The analysis, which also found 1-year survival rates improved in the UK, involved a team of researchers from all corners of the world. The NHS hit back at the study, saying survival rates have never been higher, and said the report is based on out-of-date data. Staff shortages in the NHS are causing thousands to be diagnosed with cancer too late. More than 100,000 patients a year are diagnosed with cancer too late because of NHS staff shortages, a report warned earlier this month. 1 in 10 diagnostic posts are vacant, which has left some hospitals unable to cope with a rise in the number of referrals. It has meant nearly half of all patients are diagnosed when the cancer has spread, which dramatically reduces the chance of survival. Cancer Research UK, the charity behind the report, said more money should be spent on recruiting oncologists and radiologists. It said thousands more are needed if the government is to meet its pledge of diagnosing 3 in 4 cancer patients at an early stage by 2028. The report said 115,000 cases were spotted at advanced stages in 2017. Yet if bowel cancer, for example, is picked up at the earliest stage, more than 9 in 10 patients survive. If it is diagnosed very late on, 9 in 10 die. Cancer Research UK's clinical advisor, John Butler, who co-authored the study, said, "There isn't one specific reason why survival in the UK has improved. Over the last 20 years we've seen improvements in cancer planning, development of national cancer strategies and the rollout of new diagnostic and treatment services, for lung, ovarian, and esophageal cancer in particular. Survival has increased largely because the quality of surgery has radically improved, and more surgery is taking place than before. More people are being looked after by specialist teams, rather than surgeons who aren't experts in that area. But while we're still researching what can be done to close the survival gap between countries, we know continued investment in early diagnosis and cancer care plays a big part." Mr. Butler, a consultant surgeon at the Royal Marsden, added, "Despite our changes, we've made slower progress than others." Sarah Hyam, Cancer Research UK's Director of Early Diagnosis, said, "More people than ever before are surviving cancer thanks to research and targeted improvements in care, but while we're on the right track, the numbers show we can certainly do better. We will not see the necessary improvements in diagnosis and access to treatment unless we have enough of the right staff across our NHS." Cancer Research UK has been calling for staff shortages to be addressed because, quite simply, it will give people a better chance of surviving the cancer. If we are to achieve world-class cancer outcomes in the UK, then we need to see comparable investment in the NHS and the systems and innovations that support it. She added, "It's never been a more crucial time for the government to put new money where it matters." An NHS spokesperson said, "This report is based on out-of-date data, and in the 5 years since the study's research ends, cancer survival has actually hit a record high, thanks to improvements in NHS cancer services, including the introduction of revolutionary treatments like proton beam therapy and immunotherapy." The NHS long-term plan will build on this progress by ramping up action to spot more cancers at the earliest possible stage when the chance of survival is higher, saving tens of thousands more lives every year. Data shows that 3/4 of NHS services are failing to treat cancer patients quickly enough. Hospitals are meant to start treatment within 62 days of an urgent referral by a GP in 85% of cases. But 94 out of 131 cancer services in England failed to do that during 2018-19 compared with 36 5 years ago, BBC analysis has found. How have 5-year cancer survival rates changed over the last 20 years in the UK, Australia, Canada, New Zealand, Ireland, Denmark and New Zealand? 199599 UK, Australia, Canada, Denmark, Ireland, New Zealand, Norway. Esophagus 8.6, 18.3, 13.5, 5.1, 10.9, 13.6, 8.7. Stomach 14.1, 25.7, 21.5, 14.0, 17.3, 21.3, 21.3, 47.0, 59.6, 57.9, 49.1, 50.0, 59.3, 55.7. Rectum 47.8, 59.1, 57.5, 48.1, 47.6, 56.3, 57.3. Pancreas 3.36.4, 7.0, 3.2, 5.6, 8.8, 4.4. Lung 7.2, 13.3 15.4 8.2 9.3 11.5 10.8 ovary 27.3 35.5 35.5 32.0 27.8 31.9 37.02 01014 UK, Australia, Canada, Denmark, Ireland, New Zealand, Norway. Esophagus 16.2 23.5 16.3 14.7 21.9 16.9 19.4 stomach 20.8 32.8 29.8 22.6 28.4 24.5 26.9 colon 58.9 70.8 66.8 65.7 61.8 62.1 65.4 rectum 62.1 70.8 67.0 69.1 62.4 65.4 68.8 pancreas 7.9 14.6 11.1 9.6 9.6 8.2 9.9 lung 14.7 21.4 21.7 18.9 19.8 15.5 20.4 ovary 37.1 43.2 40.3 42.1 36.0 36.3 46.2 percentage change UK, Australia, Canada, Denmark, Ireland and New Zealand. Norway. Esophagus 7.6 5.2 2.8 9.6 11.0 3.3 10.7 stomach 6.7 7.1 8.3 8.6 11.1 3.2 5.6 colon 11.9 11.2 8.9 16.6 11.8 2.8 9.7 rectum 14.3 11.7 9.5 21.0 14.8 9.1 11.5 pancreas 4.6 8.2 4.1 6.4 4.0 to 0.6 5.5 lung 7.5 8.1 6.3 10.7 10.5 4.0 9.6 ovary 9.8 7.7 4.8 10.1 8.2 4.4 9.2. Let's block ads. Why?